Hey guys, so this is Eric, and today I'm going to be talking about my senior year mentorships. So I started off the year in medical orthopedics in September 2020, and I was only able to stay for a month as the whole COVID thing shut me down a little bit. And I was with Dr. Patton, who's a hand and elbow surgeon at the Winrock Clinic, for about 7 8 hours per week. I was not able to get into the surgery center due to COVID restrictions. So every day I would come in and observe Dr. Patton in clinic and see him commonly diagnose things like basal joint arthritis or PIP, DIP joint, or in the wrist and the ulnar. So the treatments I would always see him suggest would either be arthroplasty, which would be like complete reconstructive surgery of a arthritic joint, such as we have here. Cortisone injections, which are steroid shots that effectively reduce inflammation for like 6 to 7 weeks, not a permanent solution. And sometimes you would see people who just need to have a little bit higher pain tolerance because there's unfortunately nothing that could be done. I also found it useful to study hand and wrist charts like this, so my days are made a little bit more sense at first. So some of the things I took away from there is that money is an important part of medicine, especially in a huge clinic like NM Ortho. It's a big part of it. The volume of patients they're seeing and the cost of that type of treatment is really high. So the money is good. Obviously, it makes it a really good career if you want to be a doctor, but it can be a little bit bad when you see a little bit of price gouging. Some things are a little bit more expensive than they should be. Patients are always prioritized really well, but to an extent, you physically just can't give the same level of care to 100 patients you can give to like 30. So another thing I learned that for when I'm older, sometimes it's better just to live with orthopedic pain because joint replacements are only worthwhile if you're already in really bad shape. And sometimes there's things that just can't be done. Ethically, surgery is a little bit difficult to validate to anyone, especially to like an insurance company, because it's a highly invasive procedure with a lot of risks, and it's marginally worth doing. It's also pretty. It was weird to think about just the quality of life impact that like you as a surgeon, your impact could have on someone physically modifying their body, which is it's actually pretty cool, but also it's a little bit daunting. So after that, I had about a 2 month break as I was a little bit quarantined like everyone else. And then in January 2021, for the second semester, I started going to Pediatric Associates, where I was with Dr. McNamara. And I've been going in about 4 to 7 hours per week, and I will keep going till the end of the year. Um, so here are just a few pictures from the clinic. We have the exam room. They all look the same. They all have the same features like the baby scale, the alcohol swabs, the depressor, the otoscope, and such are in there. And then here's actually a picture of Dr. McNamara in her room. This is where we would go in between patient visits. This is where she would fill out medical charting and such. I have a picture of some of the tests we would do, such as like strep tests. We have the centrifuges for urine analysis and a microscope. Uh, Here are these books are actually up in this picture in McNamara's office. These are the books I would always read when we had a little bit of extra time because I don't really have access to medical dictionaries at all times, so it was really fun to just kind of like see them. And then here we have a picture of something called a growth chart, which is a big part of pediatrics. It's a relatively accurate gauge of like whether a kid is doing well, if they're growing well. That's one of the most important things you can analyze as a doctor. Other things have to be kind of seen by parents and then talked about because obviously kids can't really give you their symptoms. So some of the takeaways from here is it's really cool to see like McNamara and her real relationships developed with like her families and patients. She knows them all by name. There are some people who were her patients when they were kids and are now bringing their kids in. Kids are fun to work with. Like there were definitely some really cute kids. It's sad to see them cry a little bit, but also at the same time it's kind of funny because it's just a little kid being a little kid. And also, I'll be getting my degree in biochemistry in college, and it's good to see like how relevant that really is, especially to all fields of like internal medicine. So it was really good to see that. And then in the end, I really do want to say thank you to Dr. Patton and Dr. McNamara and the medical staffs. I was really excited to be able to do this, especially during the beginning of the year. It was really amazing to get out of the house to do this for the first time. Then second semester with McNamara, I've learned a lot. I'm really excited to be a doctor after all of this. Like I'm pretty sold on the career, and I know it's going to be a hard path, but like this has really helped me, and this was arguably the highlight of my academic year. So I've been really excited to do it, really happy, and it's just been a really good experience. I wish there was a way to share in this presentation how much I really learned, but there really